Hi guys, welcome back to my channel. If you're new here, I'm Abbas Ali, a full-time orthopedic surgeon, a faculty of orthopedics and a part-time YouTuber. In this video, I will talk about USMLE. It's a US medical licensing exam that is necessary to get into post-graduation, residency or fellowship programs and eventually practice there as a doctor. This has been a frequently requested video on my channel and I thought it's time I get this one done. So without further ado, let's get on with it. So let me just read out what's written on the official USMLE website. The United States Medical Licensing Exam, that is the USMLE, is a three-step examination for medical licensure in the US. The USMLE assesses a physician's ability to apply effective patient care. It simply means this exam is just to make sure that your medical knowledge is adequate and your skills are up to the reasonable standards. Now in this video, I will try to give you a big picture of what USMLE is all about. After watching this video, I want you to go through a series of podcasts where we have three awesome people, all in various parts of their journey to USMLE. In these podcasts, we do a massive deep dive discussing the nitty-gritty of the various issues, study materials, resources, tips and tricks about USMLE, ranging from discussion of visas, marriage, affordability, timelines, travel, food, electives and many more things in great detail. It was definitely not easy making them, so be sure to watch them if you want to know everything about USMLE. Now let's start this video. See, USMLE is a three-step exam testing your knowledge in basic medical sciences as well as deep understanding of its application in clinical scenarios. These three parts or steps of USMLE are Step 1, 2 and 3. Step 1 is an MCQ exam with a single best response. It has approximately 280 questions which is supposed to be answered in 7 blocks of 1 hour each. So that roughly makes 40 questions in each block, which is of 1 hour duration. You're allowed to take breaks whenever you want to, but only between blocks and not while you're solving a block. And the total break time should not exceed about an hour. That makes this exam an 8-hour-long ordeal. Now, Step 1 focuses on testing your knowledge in basic medical sciences. So the subjects tested are your anatomy, physiology, biochemistry, pathology, and all these other subjects. The result of this exam is a 3-digit score. Well, USMLE program does not disclose how they calculate it, but theoretically it ranges from 1 to 300. And most people score in the ranges of 140 to 260, and 260, trust me, is considered an amazing score. Also, do note that the 3-digit score system of Step 1 is going to be replaced by a simple pass or fail after January of 2022, something you need to consider if you're planning to take this exam later. Now, Step 2 has two parts, the CK and CS. CK, or the Clinical Knowledge Exam, is also an MCQ exam with a single best response of 320 questions this time that need to be answered in 8 blocks, which brings the total exam duration to 9 hours if you also include the break time. Step 2 CK focuses on testing your knowledge in clinical subjects like medicine, surgery, pediatrics, OB/GYN and all these other subjects. Now it's not as straightforward as it seems because Step 2 CK heavily relies on your deep understanding of basic sciences and tests its clinical application. So it is strongly advised to have a good background of Step 1 content when giving your Step 2 CK. Step 2 CK also has a 3-digit scoring system. Now, on the other hand, Step 2 CS is a clinical skills exam, in other words, a practical exam where you have to examine 12 simulated patients or patient actors. You will be allotted 15 minutes to examine and 10 minutes to write down your notes, basically 25 minutes per station. Also, it's just a pass or fail exam. Now, one very important thing you should know is that although Step 1 and Step 2 CK can be taken in many parts of this world because there are so many centers across the countries, but Step 2 CS has to be taken only in the USA and you must schedule your exam at least 4 months prior because there are only 6 centers for CS, which as you can imagine get filled up pretty fast. Now Step 3. Now, Step 3 is a 2-day exam. The first day of testing includes around 230 MCQs divided into 6 blocks. So it's approximately 7 hours including the break time. The first day of Step 3 focuses on assessment of knowledge of basic sciences, history taking, physical examination and use of proper diagnostic tests. On the second day of Step 3, there are approximately 9 hours in the test session. This includes 180 MCQs divided in 6 blocks as well as 13 computer-based case simulations. Now each case simulation is allotted a maximum of 20 minutes. The second day focuses on assessment of your ability to apply medical knowledge in the context of patient care, and it tests your medical decision-making skills. Now that was the structure of the exam. Now let me just put everything in perspective. See, what's the end point of this exam? To get into residency, right? So let's just start there so you can understand things better. To get into residency, what do you need? You need an interview with the various hospitals and university residency programs. Now, to get an interview, you need to submit an application, and this application is submitted on 15th of September every year. Now, the question is, what do you need for this application? You need USMLE Step 1 and 2 scores, and also a few letters of recommendation from people you have worked with. You also need a strong personal statement telling the committee why they need to select you and why you want that specialty. Now, once you submit this application, all the institutions and universities will go through the applications submitted by everyone and select the candidates they are interested in, and then call them for an interview. Now, if you impress them there, you will be given the spot. It's as simple as that. So what really matters in the end is if you can get an interview or not. Now, how do you get that interview, or how do you get to sit in that hot seat? That's the million-dollar question we will discuss in the podcasts. But the short version is that there is more than one way. You definitely need a decent Step 1 and 2 score, no doubt about it. But is that the only requirement? Absolutely not. But they can definitely save you from getting filtered out from the ocean of applications. Then what else? You also need good letters of recommendation from top doctors recommending you for that spot. Now, where and how do you get those letters of recommendation? Well, you get them by doing some clinical or research work in the USA. While working there, when you interact and work with your superiors, you are very likely to impress them with your dedication and sincerity. And that's when you get those letters of recommendations. And once you have all the ingredients, you will be in a very good position to sit in the interview and tell the selection committee why they will make a big mistake if they don't pick you. No, obviously you should not say that. So in summary, USMLE is not only a score-based exam like many other entrance exams you come across. It's got a plethora of variabilities. You can only have an amazing score and get an interview. You can also have an average score, but if your overall personality and letters of recommendation are good, you will still get the interview. Unfortunately, sometimes you can have all of it and still not get an interview. And I think that's the most beautiful as well as the most painful thing about USMLE. There is no one way you can get into this system of training. But if you do manage to get into it, it's highly rewarding both in terms of money and training. Now, if you want to join us for deep discussions into everything, be sure to watch or listen to those podcasts. Links will be there in the description below. Tell me in the comments if you find this video useful. If I've helped you in any way, click the thumbs up button and share this video with your friends who are considering USMLE. If you have not already subscribed to the channel, consider subscribing and don't forget to click on the bell icon. I will see you in the next one. Till then, take care. Bye-bye.